But of course, you can imagine if you give those huge doses to patients on anticoagulations, then you run into problems. And there is a possibility to give the MK7 in relatively low doses so that it is beneficial to the general population and it's not harmful for those who are on oral anticoagulant treatment.
Interesting.
And in fact, there have been publications that you get a much more stable way of anticoagulation if you would combine MK7 with the Coumadin therapy.
Interesting. And so by combining it, and perhaps you can mention the doses that you'd recommend, with someone on Coumadin, you're not going to impair the lowering or the elevating of the prothrombin time to prevent the clotting ability, but you'll still get the benefits of the vitamin K2 on preventing osteoporosis and cardiovascular disease.
I don't know at this time whether during anticoagulation, during Coumadin use, you will have the same effect as preventing against cardiovascular calcification or so. Anyhow, I do know that if you use a dose of about 45 micrograms a day of MK7, that you don't seriously interfere with the therapy. So those people may not benefit from it.
Oh, okay.
Anyhow, they are not in harm. There's not any harmful effect.
Okay. So just to summarize, I just want to make sure that I understand what you said completely on the earlier question. Because of the relative innocuous or benign nature of vitamin K, even at these huge physiological doses that seem to be far outside what one would experience in a normal environment, from your understanding and review of the literature, there's really not a harm that you're aware of outside of Coumadin therapy.
Exactly. You have to realize that in Japan, Menaquinone 4 is used in the 45 milligram per day as a drug in tens of thousands of osteoporotic women. It's a drug against osteoporosis. We did.
Is it more commonly used? Excuse me, than the phosphonates?
No, I would say bisphosphonates. No, I think you should use bisphosphonates, maybe in combination with MK4, but not MK4 alone. I think bisphosphonates is far more powerful. But we have done a similar study as the Japanese, with also the very high dose regimen for 3 years among 350 women. We have not seen any adverse effects.
Okay, what type of doses were you using?
45 milligrams a day, so also the very high dose. And we have specifically investigated also blood clotting, and there is really no deviation in the blood clotting. It's harmless.
And that's a total dose per day, so would it be like 15 milligrams 3 times a day that you're using, or?
Yeah, that's it. Yeah, exactly.
Okay.
Yeah.
Excellent. Now, I'm wondering with the effects. I mean, you mentioned the study on osteoporosis, and then your use of MGP as a vitamin K parameter or index. Another functional protein that the vitamin K2 affects is the osteocalcin. And is there an assay that looks at that rather than the MGP to measure vitamin K status?
Yeah, then you measure the vitamin K status of the bone, and this assay is commercially available. Okay. It's from a Japanese company, Takara, and they send it out, but it's for research purposes only. It's not for diagnostic.
Okay.
It is commercial, it is commercial, but only for investigators and not for the routine doctors.
Okay, so, but do you think that it would seem intuitively there should be a correlation between a sufficient osteocalcin level and an MGP? So because it's due to the same factor, vitamin K2 status.
Yeah. It just depends, of course, how efficient the tissue can take up the vitamin K.
Okay.
And it could be that bone takes up vitamin K more efficiently than vessel wall. And maybe that sounds a bit strange, but it's true. The vessel wall doesn't have so many capillaries that supply it with blood itself. It guides the blood, yeah. But it's just like a pipe, and when you look at the tissue, it is completely white, and it doesn't contain so many small blood vessels for its own benefit. So the uptake by the blood vessels is not that easy, I think.
Okay, so I'd like to go deep with the vitamin K, MK7 versus the MK4 again, and it seems the biggest issue is this absorption, and can you explain why that is? And there's that you need such a larger dose of the MK4. Is it that the MK4 isn't absorbed well and the MK7 is, or is it solubility, or what do you think is going on there?
Yeah, when we compare, not foods, because in foods you have the food matrix, and that can have a major difference. But if you compare the pure compound dissolved in oil or whatever, and you take it, you ingest it, then you get absorption which is comparable for K1, for MK4, and for MK7.
Mm.
And I think that in the liver you will see comparable levels of all three at start. But then the liver will start secreting the MK7 and retain the K1 and also MK4. MK7 is more lipophilic. It is more in the fat fraction, so it is incorporated into LDL, and K1 is not incorporated so well. So that is the transport vehicle, and I think the liver just uses the MK7, 8, and 9 to supply the what we say extra hepatic tissues with vitamin K.
Now you mentioned these other forms of the MK7, 8, and 9, and probably others too. Is there a danger of using an isolated extract? And I'm not sure that, and I think you have actually been instrumental in developing some of these MK7 preparations. But is the MK7 exclusively MK7? Is it isolated extract, or does it have these other components that are part of what it's also seen in its natural form, like the MK8 and 9?
It's bound to a carrier, and so it's not pure, but it contains almost exclusively MK7. There is a little bit of MK6 in it because it is produced by Bacillus subtilis natto, and that is a bacteria growing on soybeans. And this bacteria makes MK7 for its own benefit. It uses it, but it makes also a little bit of MK6. That is a very comparable compound, a little bit smaller, but it has the same active group, so it's very comparable. That's all what's in the MK7 preparations. The MK8 and 9 are very interesting for the dairy industry, mainly those who make cheese and curd cheese. You know what is curd cheese? Cottage cheese?
Sure,
Yeah,
sure,
okay.
Absolutely.
Okay. Well, these products contain a relatively high amount of methanones 8 and 9, so that's also
Really?
vitamin K2. Oh yes. If you take 100 grams of cheese, you eat the same quantity of vitamin K2 as what you get from a supplement pill, which is normally marketed. That's the 45 micrograms. So 45 micrograms is normal what is present in 100 grams of cheese or curd cheese.
Wow. Is that the other major source other than natto of the vitamin K2?
Yeah. Well, it's not extracted, of
Right.
course,
It's part of the food
from
product.
cheese, but yes. And if people don't want to buy their supplement pills because they say I don't need pills, I eat healthy,
Right.
then I say okay. Then I say then you should eat curd cheese because say normal cheese, regular cheese, that's pretty fat. It contains a high amount of animal fat, so that's saturated fat. It's not so healthy, that component. If you take curd cheese, even the full fat curd cheese is much, much less fat than a regular cheese. And these times you have skimmed curd cheeses, which are very, very good. They're tasteful and creamy when you taste it. So I prefer the skimmed curd cheese, and that contains a high level of K2. If you take 100 grams of curd cheese every day, then you get your vitamin K2 supply to the same extent as what we found prevent 50% of the cardiovascular mortality.
That is just a shocking observation. I don't think I've ever seen or heard or read that, and maybe it's just my negligence, but that is a really powerful